Joining us now, Carol Gomes. Carol is CEO of Stony Brook University Hospital on New York's Long Island. Thank you for joining us this morning. We appreciate it. Last time, I think, the last update we had was that the hospital had roughly 70 COVID-19 patients out of, what I think, 624 beds. Can you update us on that,
Yes.
Ms. Gomes?
Sure. Well, we're well over that number. We're much closer to the 200 number with an additional nearly 200 PUIs, or what we call persons under investigation, meaning specifically that they are in the process of being tested. So we've seen a significant surge in the number of positive cases. And in addition, we've also increased our capacity well beyond that 624. As you've probably heard, the governor of New York has requested for all CEOs at New York hospitals to increase surge capacity by 100%, which means we would have to double our beds. And we've been actively engaged in the process of expanding our bed capacity over the last 3 weeks, with a continuation of that process over the next several weeks ahead of us.
When do you expect the apex is what the governor has indicated? Is that what you're seeing? And how would you characterize the state of how everyone's handling this? All of your medical professionals, the amount of equipment they have, how chaotic is it at this point, or is it still, prior to the apex, you're still doing pretty well in most respects?
Well, there's no doubt about it that we're being stretched in terms of our labor pool, in terms of our capacity. These are very ill patients that require intubation and ventilation. And so it would be very safe to say that we are pushing the limit in terms of our resources, but we're steadily focused on our plan to increase capacity. Our goal is to increase to 235 intensive care beds from a much lower number of 65. So it's putting stress on the system for sure. And in terms of our staff, they are coming to work. Stony Brook Medicine individuals, healthcare members of our team are so laser focused on the mission to provide the best care possible with the resources we have. Yes, it is true that there are difficulties in terms of our supply chain activities, but we are actively engaged in doing everything humanly possible within our control to obtain the necessary resources and supplies to keep not only our patients safe, but also our team members safe.
And if, in terms of the increase in COVID positive patients, any slowing in that at all in terms of the increase? Do you foresee having 2 patients on a single ventilator? That has not happened yet, but it's something that you would imagine that will be something you do at Stony Brook?
Yes. We are basically preparing for the worst and hoping for the best. So we've been a bit ahead of the curve in terms of the preparation of the sharing of vents. Our respiratory therapy team has worked very closely with biomedical engineering and our engineering department at Stony Brook University. We are really tapping the potential and the level of research, innovation, and creativity and ingenuity here at Stony Brook University and Stony Brook Medicine, tapping into every conceivable resource that we have in order to try to stay ahead of the curve. And I apologize, I didn't answer your question about the apex. So we've heard on numerous occasions at various press conferences and even within our own team's statisticians that the apex may be coming in 7 to 14 days, in 14 to 21 days. I've heard a model yesterday where it may be 14 to 45 days. So we are seeing an escalation in cases, and we are seeing an increased number of patients being intubated more readily closer to our emergency department than we really wish to see. So we are seeing this escalation. There's just no way to know, honestly, when this apex will arrive. But again, the Stony Brook Medicine team is laser focused on ensuring that this surge plan is active, ensuring that we're focused, and ensuring that we're hitting the targets and goals on a weekly basis to accommodate the surge.
Last question, Carol. Have any doctors at Stony Brook administered any of these therapeutics, whether it's the remdesivir or hydroxy or chloroquine? Do you have any of that at this point? Have you asked for any?
We do have it. We're working very closely with our pharmacy department, with our antimicrobial stewardship team, and with various infectious disease physicians, as well as our ICU physicians, to ensure that we are utilizing evidence-based literature to support treatment and using appropriate medical guidelines for such treatment. We also are engaged in various clinical trials and protocols to provide whatever treatment and pharmaceuticals that we have available to us that have been proven in other settings. So we're trying to avail ourselves of any opportunity to fight this good fight.